In this video, we will be discussing both consent and what it means for a patient to have the capacity to give their consent. So what is consent? Consent in simple terms can be thought of as the permission given to a medical staff member by a patient to carry out a process or procedure on said patient. It is a continuous measure and must be given at all stages of the medical process. Giving consent is voluntary and a choice made by the patient. As a medical professional, it is important you do not give the impression that consent is merely a formality. For example, when having a patient sign any legal documentation or when attempting to gain their consent to carry out an operation or put them on medication. A patient must have given their consent before you provide them with any medical treatment or carry out any type of medical investigation. When carrying out any type of medical procedure, the following ethical principles should be considered at every stage of treatment. These include the following. Non-maleficence, meaning not to cause intentional harm to the patient. Beneficence, actively helping the patient and providing treatment that will improve the well-being of said patient. Autonomy, the patient, if able, has the right to make their own decisions surrounding their own health. And finally, justice, treating patients fairly and equally in terms of administering healthcare. Next, we will discuss capacity to consent. Capacity to consent states that every adult patient is considered to have the ability to make decisions surrounding their own health and healthcare. As a medical professional, you have the duty to help your patients make the best possible decisions for themselves, giving them all the relevant support and information at every stage of the process. It is important to note that a patient has the right to have a proponent of their choosing present during any discussions about any aspect of their condition. If an adult lacks the capacity to make decisions surrounding their condition or treatment, they are still entitled to the same respect for their dignity and integrity as a patient who retains full capacity to consent. Their opinions and views should still be taken into account and they should still be involved in the decision-making process. As a medical professional, you should be aware that a lack of capacity to consent may arise after a long-term illness or condition. Therefore, a person lacking the ability to understand or retain any necessary information to make an informed decision would fall into this category, as would a person who understood the information presented to them but were unable to communicate their decision. When assessing a patient's capacity to consent, you should consider the following: their level of understanding, their ability to apply this understanding to their current condition and make a decision, and finally, their ability to communicate that decision. You should never make assumptions in relation to a patient's ability to give consent. There is no implication that because a patient is unable to make a specific decision, they will not be able to make decisions in the future. In the following excerpt, Dr. Emer Spain, Senior Lecturer in Health Law at the University of Limerick, discusses this in more detail.
Doctors, again, are often faced with decisions around whether or not they feel that a patient has capacity to consent to a particular treatment in their surgery. And I think for GPs, it's very important to understand that in Ireland, a functional test for capacity operates, which means that it's decision specific. So it's about whether the patient can consent to that particular treatment and that at that particular time. So it recognises a hierarchy of complexity. So some patients might be able to consent to simple procedures or treatments, but not to more complex procedures. Other patients might be able to consent to a treatment today and not tomorrow if their capacity is fluctuating.
In the case that an adult lacks the capacity to make a decision, as a medical professional, you should seek out the consent of the person who can legally make that decision for them. If no such person exists, you'll have to decide what is best for the patient. When doing this, consider the following. Which treatment will be clinically most beneficial? The patient's previous wishes? Could the patient regain capacity to consent to any decisions? The views of those familiar with the preferences of the patient? And finally, the views of medical staff who may have been involved with treating the patient. The purpose of this video is to give a quick overview of what a medical student or staff member should always be considering when it comes to consent and a patient's capacity to consent. Take the information learned from this video and apply it practically in the future when dealing with patients.